Now let's talk about the undifferentiated spondyloarthritis. The undifferentiated spondyloarthritis is a type of spondyloarthritis which is usually found at the sites which have not developed completely. Now, usually it was usually clumped together with the juvenile spondyloarthritis, but in recent textbooks and text, it has been differentiated from the juvenile one, because undifferentiated spondyloarthritis is the one where the spondyloarthritis or the symptomology of it starts usually at the peripheral sites but does not complete its course. That if the enthesitis starts, it does not complete. If the synovitis starts, it does not involve whole of the synovial joint. So in undifferentiated spondyloarthritis, the sites of involvement are usually incomplete or are in course of completion, that they do not complete in time. Next, the diagnostic criteria. Now, how to diagnose a patient with undifferentiated spondyloarthritis? Now, one of the following has to happen: either uveitis, psoriasis, or Crohn's disease. If the patient has one of these along with two of these, arthritis, enthesitis, dactylitis, inflammatory back pain, or family history of spondyloarthritis. If the patient has either one of these, the first three, or two of the last five, we can have a definitive diagnostic criteria upon which we can diagnose the patient as having undifferentiated spondyloarthritis. And you do remember that undifferentiated spondyloarthritis is the one where there is not complete course of symptomology of the patient.